Good evening, ladies and gentlemen. Thank you so much for joining us. My name is Kenya, and I work for Medtronic. This evening, we have a presentation that's being brought to you by Dr. Mansour, who's going to be introduced to you in just a few minutes. But while we're waiting and giving other people an opportunity to join us, there's a few things I want to inform you about. One, this is anonymous. We do not see your names. We do not see your faces. This is a muted webinar, so unfortunately, we will not be able to hear you. If you do have questions, please take a moment to fill the questions out in the poll at the question and answer poll at the bottom of your screen, and we will answer those questions at the end of the presentation. But for now, there's a poll that is on your screen. It says that there's a few questions on there we would love for you to fill out for us, and we're able to share this information with Dr. Mansour so he has a better understanding of who's on the call this evening and how we can further help you. So if you would just bear with us, there are quite a number of people who've registered, and we'd like to give them some time to come on board. So again, if you are just now joining us, please take a moment to fill out the poll, and I'll be back in a few minutes with some more information. Welcome to those of you who have just joined us. My name is Kenya, and I work with Medtronic. We are welcoming you to this webinar this evening. Please keep in mind that this is anonymous. We do not see your names. We do not see your faces. If you have a question, your phone line is muted, but you are able to put your questions into the chat at the bottom of your screen, and we'll be more than happy to answer your questions at the end. In the meantime, while you're waiting, and we are going to begin in just a moment or so, while you're waiting, if you would go ahead and complete the poll that you see on your screen, we would greatly appreciate it. In just about a minute, I am going to introduce my counterpart at Medtronic, and she is going to introduce Dr. Mansour. So in just about one more minute, we're going to get started. Well, again, welcome. Thank you guys so much for giving us your time this evening. My name is Kenya, and I'm with Medtronic. But at this time, I'm going to introduce my counterpart. Her name is Jenny Lee, and she is going to introduce your presentation, your presenter this evening, Dr. Mansour. Jenny Lee, it's all yours.
Good evening, everyone. My name is Jenny Lee. Thank you, Kenya. And I work for Medtronic. And tonight, I have the pleasure of hosting this webinar where you will hear from Dr. Will Mansour, who is a gastroenterologist with Gastroenterology Consultants in Savannah. Dr. Mansour treats all GI and liver disorders, including GERD, inflammatory bowel syndrome, colorectal cancer screening, difficulty swallowing, cirrhosis, irritable bowel syndrome, and fecal incontinence. And with this being said, Dr. Mansour has a special interest in treatments for fecal incontinence and looks forward to discussing this more in detail tonight. Just a reminder, please use the Q&A box at the bottom of your screen if you have any questions. Welcome, Dr. Mansour.
All right. Thank you, Jenny Lee, for having me in Medtronic. So like she was saying, my name is Dr. William Mansour. I'm one of the gastroenterologists at Gastroenterology Consultants of Savannah. So you may have gotten a email or text or seen a Facebook ad about this webinar that we're doing. So this is really just to promote awareness and that there is something out there more than what has been prior for fecal incontinence, and just wanted to let some of you, maybe my patients or a patient of the practice, that there are other options out there for you when medications, aren't really working very well. So this webinar is mainly going to be focusing on bowel control in terms of fecal incontinence. So that's really looking at accidents and urgency, and really focusing on other things other than medication that we can be doing to help with this kind of embarrassing symptom. A lot of people, don't even want to discuss this symptom of fecal incontinence with us as a provider. And some is quoted about 54% of people haven't even discussed their issues of accidents and urgency with their provider. And it's understandable when you're having this kind of when you're having these symptoms that this can be embarrassing, and that it's something that you don't want to bring up to a provider. And while I'm having this webinar is to say that we can help if it just is brought to our attention that these issues are happening. So some symptoms you may be thinking is, are you ever going to regain control? Can you go outside to an event where you don't know where there's a bathroom? A lot of people, we kind of start the conversation with, they're afraid to leave home, and they can't even leave home because if they leave, there's no bathroom. They won't know where to go. They'll have an embarrassing accident in the middle of public, and they just are kind of homebound because of these symptoms. So just, as you're aware, as a physician, I do hear this. And as a patient, you might not know that it is more common than you think. Fecal incontinence and accidents are about 1 in 12 adults. So, that is 21 million adults in the US. It affects women and men. So I see both genders, all ages, that come in with this complaint. In fecal incontinence, it can cause a lower quality of life because of you're no longer to go out anymore. You're having the embarrassment, can lead to depression and all these issues that kind of are surrounding fecal incontinence. Where as a physician, just want you to know that we do have options and you're not alone. So kind of what is expected and what isn't expected. Because some people just think, well, maybe bowel incontinence and losing your stool is kind of a normal part of aging. But it really is not. As you age, you may have change in your bowel habits. However, you still should be able to control your stool, where you don't have a soiled pad, or where you notice there's mucus in your underwear, or there is smearing, and then even like most people think of fecal incontinence as a large accident. All those things really, as you age, you still should be able to do. So if you notice any of these things, like where you're having to plan activities around the bathroom so you know that you can go at that time, you when you go to urinate, you also go to the bathroom that you weren't aware of. Your underpants are stained. You're having to use more protective pads and protective garments. That is not normal as you age, and so it's something that you do need to bring up to us as providers. So what we're mainly going to be focusing on is obviously you probably have tried some kind of medication for your fecal incontinence. And now we're really talking about alternatives to medication, which is neurosacral stimulation, in which so this is what Medtronic is has to offer with how does this control our bowels, and how does this this alternative to medications kind of play into the role of fecal incontinence. So there's a bowel brain communication that helps with you to control your bowels. So you have sphincters in your rectum area that are stimulated by the nerves. So those send to your brain where they say, okay, well, it's time for me to relax to go to the bathroom, or it's time for me to kind of hold my stool in. So, maybe you can't find the bathroom at the time, and you should be able to hold those sphincters tight for you to make it to the bathroom. So as stool and your waste goes through the digestive system to your rectum, then it's going to stimulate that nerve to say, okay, I'm not ready to go to the bathroom, or okay, I'm ready to relax and go to the bathroom. So for people suffering with fecal incontinence, there is good news that, you can get some of your life back and really improve your quality of life. There's two kind of things that we do. And the first thing is obviously conservative treatments, which we'll touch base on. And then the next is advanced therapies, which is why we're having this webinar, to really kind of tell you what other therapies are out there so you don't feel discouraged and don't feel like you can bring this up with your provider. So with conservative treatments, that's usually when you come to see me at the beginning of if you have done nothing prior for this, there's some simple, easy things that we can tweak and work on to see if that helps with your incontinence and losing your bowels, or the urgency, or the smearing, or that are related with losing your bowels in accidents. So we can kind of do some dietary modifications and really work with that. There's pelvic floor physical therapy. There's also medications, which most people have probably tried by the time they come to me, which is kind of the anti-diarrheal medicines, the fiber supplements, all those things to really bulk your stool, to see if, well, maybe if you can bulk your stool and make it a little bit better, that you'll be able to hold it in and not have those accidents. And those are usually where we start to see if that can improve with just those easy steps. Now, when that has not worked, and you've tried the medications, you've tried the dietary modifications, that's when we move more into advanced therapies, which is kind of what we'll touch base on really today, is the minimally invasive treatments that Medtronic has to offer that I provide as a physician for patients in our practice. So when you've tried all the conservative therapies we've talked about, the anti-diarrheal medicines aren't working, you're still having accidents, and you're noticing that smearing in your panty liner, smearing in your underwear, or big accidents, that there's minimally invasive approach, and then there's surgical options. And really the surgical options, they're pretty invasive, and I usually do not recommend them for my patients, especially to begin with. So that's really looking at repairing the sphincter to your rectum, to try to either, one would be you repair the sphincter, or you do what's called a sphincteroplasty, which is an invasive procedure to your actual anus and rectum, to the sphincter, which is a surgical option. And the other one would be a colostomy, which is where you actually divert the colon to a bag to the surface of the skin, so that now it's not coming through those sphincters anymore, and you stool into a bag, so you no longer have any fecal incontinence. Now, like I said, these are very invasive. I do not recommend these for my patient, because there are other options out there that are minimally invasive that have a very high success rate that we'll talk about. So in my practice and with Medtronic, there is an InterStim procedure. So this is a test that we do with Medtronic's bowel control therapy system that's called InterStim. So basically what it does is it gently will stimulate the nerve to the sacral nerve that goes to the rectum and the sphincters, so that you can restore that brain bowel axis with your nerve response, and able to improve on your sphincter control. This is it's clinically proven. It stops or greatly reduces bowel accidents. And it has shown that it significantly improves your quality of life, where you're no longer afraid to go outside and go to that party that won't have a bathroom nearby, or leave the house to go to a restaurant with friends, or a family gathering, where now you don't feel confined to the house, because you have the control of being able to hold your stool and go to the bathroom when you want to, instead of having these accidents. So, it's minimally invasive. and it has been around since 2011. So it's been around for a long time. And basically what this test that we're offering is an option so that you can regain some of your control. So this is usually a 3 to 7 day test. I do it in the office. It is minimally invasive, as in all we do is we put wires into your tailbone area under sedation, and some people even do it without sedation. As plenty of lidocaine, it's very comfortable, and they don't have any issues with it. We do it in our outpatient center right in the office. I place the wires that take about 15 to 20 minutes to place. And then as you can see in this picture, you wear a little belt around your waist that goes under your clothes where you can't see it. And that goes to a small external device that's worn under the clothes that is stimulating your rectum and sphincters so that it will give your sphincter more ability to be able to hold stool in for when you're out and about, so you don't have an accident. During the 3 to 7 days while you're doing this test, we do record all your symptoms, and really what we're looking at is, do you have improvement of your control? Are you no longer soiling your underwear? Are you no longer noticing that smearing that you were having? Are you able to make it to the bathroom so that you don't have an accident? And on top of that, this has been shown to really improve that urgency for when you're out in public, where previously you had that urgency where you're like, oh, I got to go right now. Where's the bathroom? And you can't make it. Say you're in the grocery store shopping, and then you feel like you have to go to the bathroom, where previously you'd have an accident. Now that urgency is decreased significantly, where you're like, okay, well, I can finish going shopping around the store and then go to the bathroom afterwards, 10 minutes, 20 minutes later after you go shopping. And that's where we test this over this 3 to 7 days to see if you have the improvement with the nerve stimulation that is being delivered by this external device. So this is just a slide showing that it is MRI safe. So it's completely safe to have this and still have your MRIs, go through the airport, all things like that. It is discreet, so nobody will see the stimulator as well. And really, so when we're looking at this and we're looking at, okay, is this the right thing for me? Some people in my practice, it may not be the right thing for them. And that's where that conversation with really discussing with myself or with your GI provider is, okay, is the InterStim the right thing that's going to help control my bowel habits or my accidents? Because different people have different reasons for having accidents and diarrhea and urgency. So there are different reasons why it could be happening, why we have different types of treatments. So if you have chronic fecal incontinence, meaning that this has been going on for several months and you're still having accidents, you've tried medications like fiber, like Metamucil, Benefiber, Citracel, it's not working. You've tried to make lifestyle changes with changing your diet, and you're still having accidents, still having soiling or smearing. And you've tried all these and it's just not working, and these treatments are just giving you no relief, that this may be a very good option for you to, number one, decrease accidents to get your life back. But number two, to really improve that urgency of when you're out and about so that you can make it to the bathroom. And so, depending on the reason for your fecal incontinence, most people are a very good candidate for this. Now, so basically, this is just talking about how this is proven. 89% of people that use the Medtronic control therapy, which is InterStim, 89% of people have experienced long-term success. And what I've seen in my practice, and I've been doing this for about 2 years now, is that really we're kind of more even up into the 90, 92 percentile, with patients significantly improving after the 3 to 7 day test. So just within that 3 to 7 days, they know about 90% of my patients know that this is the right thing for them, and that this is really kind of what they've been missing for several years of dealing with this embarrassment. So it really helps improve your quality of life. So you're able to have your lifestyle again, go out with friends, go out to restaurants, go grocery shopping, go to that family event you couldn't go to. It decreases that anxiety around being out and being embarrassed for an accident. It really helps with your depression, and you're no longer confined to the house and confined to the bathroom and kind of a prisoner in your own home to your bowels. And it is very safe and effective. And like I said, it's just a 3 to 7 day test that we do to really see, does this stimulation to the nerves of the rectum help you to control your bowels better? This has been approved. It's been around since 2011 for bowel control therapy. So this is not something new, but it is new to our practice, being able to offer this to our patients so that they can, regain some of their life back. And so really, this is just talking about that there is an InterStim patient ambassador program that they have, where we can get you in contact with somebody that has been through this process before, with me or with another physician, and really just tell you what their experience with neuro stimulation with their accidents, and really kind of discuss that more on a personal level with you. So with that being said, that is just kind of just a very quick synopsis that I have on this webinar. I didn't want to keep you for a long time. I just wanted to let you know that we have other things to offer, and that you can make an appointment with myself, and my information is on the screen here. Or if you already are established with our group at Gastroenterology Consultants of Savannah, any one of my partners or physician assistants, they are trained in answering these questions about the InterStim and the stimulation. Obviously, I will be the one doing the procedure, the testing, but they are well equipped where you can still keep your doctor or the physician assistant that you like, and that I can at least give you that 3 to 7 day test to see if this is the right thing for you. And with that, I will give it back to Jenny Lee to see if there's any questions that I can answer. And like I said, a lot of the questions and the in-depth conversations that we'll have, feel free to make an appointment with us, and then we can really discuss those in further detail in the clinic.
Thank you so much, Dr. Mansour. And we do have a few really good questions. The first one is a patient that's asking if they have urinary incontinence. Could it all be related or possibly treated with the InterStim?
Sure. So for our sacral stimulation, we are really focusing on fecal incontinence and accidents with stool. Now, so whenever you see me in clinic, I'm very open about, we are mainly doing this for the stool accidents. So the data I presented is based on accidents with your bowels. Now, is there some crossover that can help with urinary incontinence? Yes, there is. I don't want you to feel like this would be the answer to your urinary incontinence, but if you're having fecal incontinence and bowel issues with urgency, then there is some crossover that you can see with the InterStim device as well. So some people do get relief with their urinary incontinence as well.
Great, thank you.
Mm-hmm.
Does this help with patients that are constipated?
Sure. So it is not approved for constipation unless there is some kind of fecal incontinence. But I do have a subset of patients where if you have issues with overactive bladder and you have been being seen by urology, and they have tried multiple medications for overactive bladder, it's not working, plus you have constipation, then this is a option for you as well.
Okay, great. Thank you. This is a great question. Is the InterStim therapy covered by Medicare?
Yeah, so most of InterStim is covered by Medicare. There's some documenting on my part, like we talked about in the slides, about trying lifestyle modifications, trying fiber like Metamucil or Benefiber, and trying those and failing. If you have tried those conservative managements that we talked about, then Medicare does cover this advanced therapy, especially since it's minimally invasive. Medicare does cover this.
Okay, great. We have two fairly similar questions. I'm going to kind of lump them together. Will this procedure work if there's documented pathology present, for example, Crohn's disease? There was a similar question about ulcerative colitis.
That is a good question, and that was kind of what I was talking about in the middle of the slides about, this may not be for everyone, and there's different reasons why you have the urgency in the fecal incontinence. Now, it is not currently approved for Crohn's disease or ulcerative colitis. I was watching another webinar just for physicians the other day, and looking at the use of this in patients with ulcerative colitis and inflammatory bowel disease. Now, it is not currently approved for that. It is solely approved for just fecal incontinence and that issue. Now, with that being said, I don't know what the future would hold, but really kind of improving the inflammatory bowel disease first before we kind of go down this route is obviously an option, the Crohn's or ulcerative colitis. But they are doing some research with using this stimulator to improve inflammation and ulcerative colitis, like urgency and in accidents as well.
Okay, great. Thank you. There's a question regarding surgery, and I think maybe this question is asking kind of what's after you do the test. Is surgery necessary for the permanent InterStim?
Yeah, so I'm just a gastroenterologist, so obviously I do the 3 to 7 day test. Now that test is minimally invasive. There's no cutting. You can do it with or without sedation. Most patients choose with sedation. And like I was saying, we just put a wire into the tailbone area that's not painful, it doesn't hurt afterwards, and you wear the external kind of fanny pack around your waist. It's giving the stimulation. Now, over 3 to 7 days, you will know if this is beneficial for you or not. Is this significantly decreasing your urgency and fecal incontinence by 50% is what we look for. If you notice that significant improvement, then we do have you set up with a surgeon, one of the colorectal surgeons or urogynecology surgeons. And what they do is that they will discuss implantation of the one that will be permanent under your skin, so that nobody will know that it's visible or there. And really, it's not painful. It's you can't even tell that it's there after they just implant that in.
Right. Okay. And thank you. And I'm seeing another question. Is this procedure something that you live with for the rest of your life, or after 7 days, it teaches your bowel to behave? So to clarify, the test is temporary. And if the test is successful, then you have the permanent implant that Dr. Mansour is describing. That is continuous therapy to restore your bowel's natural function. So thank you. These are great questions.
And on that note too, which is nice, that just on that note is, now this is a temporary test, but how I look at it is it's just a test, and it gives you a very good trial run to say, okay, before I pursue this lifelong implantation, is this the right thing for me? And so now we are offering that 7-day non-invasive test, that wasn't offered in our practice before, that you can, before undergoing, the permanent InterStim placement, then if this is the right thing for you or not.
Great. Okay. Thank you for clarifying, Dr. Mansour. There's a question: if I have a bowel movement after ingesting anything from a regular meal to drinking a glass of water, how much would this help?
So really, like I said, the focus of this webinar is, as well as the focus of InterStim neuro simulation, is really, we're not looking at changing the bowel function. or excuse me, changing the bowel consistency. It's more about changing the bowel function, meaning, do you have say you drink water, food, whatever, are you going to have an accident afterwards? This would help with that without having an accident. Are you going to have extreme urgency where you can't make it to the bathroom when you're out in public? This is going to help with that. Now, will it change diarrhea to make you, oh, this is a miraculous cure where now you have formed bowel movements once a day? That's not what this is for. This is really just trying to help you regain your life back and regain control of your bowels, not to change your bowels to make it back to normal. It's really to say, okay, well, am I going to have an accident when I go out this afternoon? And really, I mean, am I going to have so much urgency after drinking water or eating that I can't make it to the bathroom? It's going to help with that aspect.
Okay, great. Thank you. There's a question here that the fecal incontinence symptoms started after sigmoidectomy after a colon perforation. It's not chronic, but intermittent. Would you recommend the InterSim for first level treatment?
Sure. So if you've tried, like we talked about, if you've tried dietary modifications, you've tried fiber supplements, you've tried, you've tried different anti-diarrheal medicines, maybe they make you too constipated, or, it's just not helping with your incontinence. And if you take nothing, you have incontinence. I mean, as long as this is, number one, chronic, meaning that it doesn't matter how you got it, if it was a sigmoidectomy or whatever, a colon resection, if it's chronic, meaning it's been going on for several months and you have accidents weekly. So if you're having weekly accidents, then this is an option that could help.
Okay, great. And this is a question, I think, just to clarify there, again, it's two similar questions. During the test, the temporary wires are connected to an external stimulator, correct? And they're asking questions about activating the battery. I'm not sure if this is related to the permanent or the temporary, but you want to just do like a quick overview of what they can expect after the test during that 3 to 7 day period.
Yeah, so we'll talk about just after the testing for me, and I can kind of walk you through a little bit of how the day looks like because both myself and Ginny Lee will be there. So what we do is while you're comfortable and you're nice and comfortable, either if you just decide with anesthesia or without, I numb up the whole backside of your area with lidocaine. We put the wires down into your tailbone area, just right above the surface, just to stimulate that nerve back there. You wake up, no pain at all because it's minimally invasive. There was no cutting. There's nothing like that. So what happens is you wear those two wires are hooked up to an external stimulator, which is probably, I guess, like a little bit bigger than this circle of my finger, like doing like an okay sign, like that circle is about the size of it. And you'll wear this pack, and Ginny Lee will go over everything with you with the stimulation aspect of it looks like a cell phone, but it's mainly only for Medtronic, but it will send that little pack on what to do to continuously stimulate your rectum and sphincters so that you can regain your control. So over the 3 to 5 days, she will play with, if it's too much stimulation or it's not enough stimulation, then we kind of go up and down and we talk to you each day of the 7 day. I mean, some people get better in 3 and they're like, okay, I already know what I want to do. But, we leave it in for at least 7 if patients want that. And we stimulate up and down depending on how they're doing. And it's not painful stimulation. Your brain actually shuts off that sensation of stimulation. So eventually it learns that feedback loop that we're providing to your sphincters, and you don't even notice that it's stimulating anymore. You just start noticing that, I went all day and didn't have significant urgency in an accident. And that's kind of how it works, is it just retrains that loop that we talked about on helping you regain that function to the sphincters.
Okay, great. Thank you for clarifying that as well. And we have one more question, and I know everyone's time is valuable, as well as yours, Dr. Mansour.
Yep.
I'd just like to remind everyone to please complete the poll that you see on your screen before leaving the meeting. We would really appreciate that. And Dr. Mansour, last question for you is regarding a colonoscopy. How does this fit into the treatment algorithm for fecal incontinence?
Yeah, that's a really good question. So that kind of goes back into play of on what's the cause of the fecal incontinence, what have we tried and what have we done. So usually if you have not had an up-to-date colonoscopy or a colonoscopy for this purpose or for your diarrhea or whatever, I usually will start with that. That's to rule out, like we were talking about earlier, Crohn's disease, ulcerative colitis, microscopic colitis. Those are all inflammatory diseases of the colon, where this may not be the best fit right now, and trying other medications would be a better fit. So I always make sure that we rule out other causes of diarrhea, urgency, and fecal incontinence before we go down this route. So usually if you're not up to date on your screening or surveillance colonoscopies, then that's usually where I start. Now, I don't make you come in for appointment after appointment after appointment, but if that looks fine and everything looks well, then usually what I'll do is over the phone ask, okay, are you ready for this test? Do you want to test? Do you not? Do you want to try more medication? Do you not? And really get a sense of where you're at with that before we go down this route, and try this out. So.
Okay, great. Thank you so much, Dr. Mansour. And again, thank you for your time this evening, and thank you for everyone who participated in the webinar, and for completing the polls. And again, Dr. Mansour's office number is on your screen. If you would please jot it down. He would love to have an appointment with anyone who is interested or has any further questions.
Well, thank you. And I would like to thank Medtronic. Thanks for having me. And like Jenny Lee was saying, please feel free to reach out to my office. And and some of the minute stuff that we didn't get to in this webinar, myself, the physician that you see at our office, or one of the physician assistants are all trained to kind of answer those questions about InterStim and about stimulation therapy.
Great. Thank you so much. And everyone have a great night.
Thanks everyone for coming out.
All right. Take care.
Bye.